Hi everybody, it's Dr. Mitzi. I hope that everyone is doing well on this rainy Thursday evening down south. I'm very excited to be here with you all for my live stream show where I talk a little bit about a subject related to multiple sclerosis and a little bit about music since I love music. So this week I have been listening to Quincy Jones. And I started watching this amazing documentary. Hey, Diane, how are you? I started watching this amazing documentary about Quincy Jones, and I haven't finished watching it yet, but I guess I just didn't realize how much music he wrote and how many amazing artists sung some of his music. So today I'm listening to Frank Sinatra, Fly Me to the Moon, on this Quincy Jones compilation album. So Old Blue Eyes is one of my favorites, so I love Frank Sinatra, and I'm glad that Quincy wrote this song. Awesome. Very good. I hope you all are having an amazing evening, and I'm going to turn Frank down. All right. Perfect. All right, very good. So I'm Dr. Mitzi Joy. I'm your board certified neurologist and multiple sclerosis specialist. And my mission is to engage, educate, and empower people living with MS to become an active part of their healthcare team. And I also want to educate people about the importance of research and how it helps us learn more about MS and hopefully will eventually lead us to a cure. All right, very good. So today I'm going to talk a little bit about some of the silent symptoms of MS. And I don't know, I may have covered this in one of my earlier live streams, but I'm going to talk a little bit about silent symptoms because many of my patients with MS say, Dr. Williams, everybody tells me I look so good. Everybody says, you know, you don't look like you're sick because I don't have as many of the physical symptoms of MS. So we're going to talk a little bit about some of those silent symptoms. The three that I'm going to cover today are fatigue, cognitive dysfunction, and then we're going to talk a little bit about the bladder. So those are the three I'm going to cover, and hopefully you'll learn something from the live stream tonight. If I have a few minutes at the end, I may answer a couple of questions, and then we'll go from there, and hopefully you'll share the video if you find it helpful or find it useful. Again, I'm Dr. Mitzi Joy, board certified neurologist and multiple sclerosis specialist. And just a couple of kind of footnotes before we get started. Thank you so much for your support of my video last week about relapses. It was so amazing to see so many people that looked at the video and seemed to get something out of it. And people shared it with their friends. And I think I got 4,000 views last week. So thank you so much for your support. And again, my goal is to really just provide information, hopefully in a way that everyone can understand. And just a few cliff notes before we get started. Again, thank you for your support. Now, the goal of these videos is really just to provide like some general information about topics. Sorry, I'm going to adjust my camera a little bit. Is to really provide some general information about topics related to MS. Most of the things that I discuss will kind of be in line with much of the general thinking of the MS community. I will probably eventually talk about some experimental theories and some other theories, but I cannot, so the purpose of these videos is not for specific medical advice. So unfortunately, if I'm not your physician, and even if I am your physician and we're not in clinic, I can't give you specific medical advice, and I appreciate that many people felt a connection with me and kind of reached out to me through my inbox and also on the post last week, but I can't speak to your specific situation. If you're having symptoms or having issues, please, please, please call your neurologist, okay, and speak to your neurologist about it. And certainly if there's something that I say in one of these videos that helps further your discussion with your physician, then that would be great. But again, I can't give specific medical advice, especially if you inbox me. And then the other thing is that I know that some folks have reached out to me on my personal page, and I don't friend my patients on my personal page just for privacy purposes. So again, thank you so much for your support, but I can't give you specific medical advice, and I don't take friend requests from my patients. So, but I'm happy to try to interact with you as much as possible on this forum, and I thank you again for reaching out. So let's talk a little bit about silent symptoms of MS, right? So all that stuff that really bothers you and kind of interferes with your function, but people don't see or they may misinterpret, all right? So let's start with fatigue. Fatigue is a super common symptom of MS, and I've heard people describe it in a lot of different ways. Hi there. Hey, everybody. Thank you for watching. So I've heard people describe the fatigue related to MS in a lot of different ways. So fatigue specifically from MS is not like your kind of run-of-the-mill fatigue. So I'm a physician, I'm a mom, I'm a wife, I do a whole bunch of other stuff. I run all over the country and give talks and lectures, and I do these live streams. So I'm tired at the end of the day, right? But that's not the same type of tired that many of my patients with MS say they experience or report to me. So people will often describe it like they have this amount of energy, okay? And if they use it up by 10 o'clock in the morning, it's gone. And then if they're good, they can kind of manage it and stretch it out over the course of the day. But they often say they hit like a brick wall, right? So whatever time it is, when that energy is gone, they just crash. And that's a very common complaint that we get with MS, is that you have a certain amount of energy, and once that energy is gone, you're done. And so many people will say, I have just enough to get through work, and when I get home, I can't really kind of do my daily functions. The fatigue kind of worsens as the day progresses, and that can happen with a lot of different symptoms of MS. They worsen as the day progresses. I've had people describe it in different ways, like they feel a heaviness. Hi there, Danielle. Thank you for tuning in. I've had people describe it as a heaviness. I've had somebody describe it as walking underwater with a fur coat on. So just kind of a very extreme heaviness, exhaustion, again, that worsens as the day progresses. It's very well described in the literature related to MS. One of the difficulties is that there's not really one spot in the brain that we can point to and say that's the spot that causes fatigue. It more commonly may be related to people accumulating a lot of lesions in the brain over time, but certainly is a well-recognized symptom of multiple sclerosis. The difficulty with fatigue is that it's something that people can't see, and it causes a lot of disability. I actually have a fair number of people who have had to come out of the workforce due to their fatigue. For a variety of reasons as well, but fatigue being one of the most prominent symptoms that they report. And so the difficulty is that other people may what's the word I want to use? They may misinterpret the fatigue as laziness. So I have a lot of people who say, you know, my family doesn't understand. They think that I just don't want to do housework. I mean, sometimes you probably don't want to do housework, but when it's related to MS fatigue, it just really is kind of like you can't. It's like you're out of gas and that's it. And so there has to be a lot of education where family is concerned. And then also, one of the interesting things about fatigue, and we'll talk about this with some of the other symptoms related to silent symptoms of MS, is that there are other things that can make that symptom worse. So for instance, there's fatigue related to MS. Okay. There is also fatigue related to insomnia. So many of my patients have difficulty sleeping at night. So they'll come in and they say, Dr. Williams, I'm exhausted. I just can't go anymore. And I say, well, how much are you sleeping? And they say 4 hours. And I'm like, ooh, that's going to make you tired, right? So you have insomnia, which can also worsen fatigue. And then also some of the medications that we give to treat other symptoms related to MS can worsen fatigue as well. So what you wind up getting is kind of this cycle, right? You've got the fatigue from MS, and then you add the insomnia on top of that. The fatigue gets worse. And then you add the medications that make you fatigue. So you got the insomnia, the medications that make you fatigue, and the MS fatigue, all just kind of going in this cycle, and things are not getting better, and they significantly impact your function. So very, very important to talk to your neurologist and talk to your doctor, look through your medication list, see what things may be contributing to the fatigue, and then you and your physician can kind of work out if there are other things that need to be tweaked to try to decrease the fatigue, or if you're having difficulty sleeping, ways to help improve your sleep to also decrease fatigue. Hey, Dr. Dietrich, thank you for tuning in. All right, so silent symptom number one, fatigue. All right, so invisible, it is a real symptom of MS, very different from your run-of-the-mill, tired from having a long day, a very specific symptom related to the MS that can cause a great deal of disability, all right? Number two silent symptom that I'm going to talk about tonight is cognitive dysfunction. So cognitive dysfunction is very common related to MS. Again, more of a function of acquiring a lot of lesions or dysfunction in the brain over time. Again, there's not one specific spot where we say you got a lesion there, that's going to cause cognitive dysfunction. But it's very commonly reported by many of my patients. The most common symptoms that we see related to cognitive dysfunction are people have slowed processing, right? Meaning it takes you longer to take in information. They may also have easy distractibility. So, a lot of people will say, I have to focus on this one thing, and if anything else kind of comes into my view, I get totally off track. And then also people have impaired attention and concentration. And so when you add all of those together, it essentially winds up being a memory problem. So many people will have difficulty with their short-term memory. They often will have difficulty with word finding, and then also kind of losing their train of thought very easily. Again, this is a very well-recognized symptom of MS, so there requires often a lot of education of family members and friends, because I will have spouses that come into the office and say, well, she's ignoring me, and we have to have the same conversation 20 times. And it's not because of someone ignoring someone else most of the time. It is because of the cognitive problems that we see related to MS, which is very under-recognized. Very similar to fatigue, there are other issues or other symptoms that can make cognitive dysfunction related to MS worse. So some of the things that can make cognitive dysfunction worse are fatigue, right? So again, you start to see this cycle. Everything kind of piles on top of each other and affects other things. So fatigue can worsen cognitive dysfunction. Has anybody ever had a night, so even before you had MS, had a night where you just totally didn't get any sleep, or a period of time where you didn't get very much sleep? That is my life currently. I've got 2 small kids, and if one of them isn't up in the middle of the night, the other one is. And sometimes I have a little trouble, with my thought process the following day. So again, if you're fatigued, your thinking is not going to be as sharp, okay? So that will worsen or pile on top of the MS cognitive dysfunction. Also, if you take medications, there are some medications that can affect your cognitive dysfunction or slow things down. Some of the medications that we may use to treat migraines, or some of the ones that we use to treat seizures, can kind of affect the cognition as well. And then also another big issue that can affect cognition is depression. So depression can cause some of the same cognitive problems that we see with multiple sclerosis. And depression is often undertreated, and over 50% of people with MS, it's estimated, at some point in time will deal with depression during the course of their disease. So it is important, especially if you have an acute change in your thinking or your memory, to again sit down, talk with your doctor, see if there have been any changes in your medicine, if your sleep pattern is interrupted, or if you may be dealing with some symptoms of extreme stress or depression that may be affecting the cognition. There are some physicians or specialists, who specifically can look at cognitive dysfunction, called neuropsychologists. They are PhD doctors who can do testing to help us understand what parts of your thinking are affected. So neuropsychological testing is a battery of tests that basically can tell us kind of what part of the memories or what parts are affected by MS, or what parts of the memory dysfunction look specific to MS. They can also tell us if fatigue may be playing a role, and they can also tell us a little bit about if there are mood issues such as depression that may be playing a role in the difficulty you have with cognitive dysfunction, if this is an issue, okay? So something to stay on top of. Again, stay in contact with your doctor. If you're having issues, don't be ashamed to let somebody know. I do have patients with cognitive dysfunction who have had to go on disability because of their difficulty thinking, and it's important to let your doctor know, so that if that's the case, those things will be documented in your record that you've been having trouble, rather than it being kind of a sudden issue when it gets to the point where, if it got to the point where you had difficulty doing your job. So cognitive dysfunction, number 2, all right? Number 3, the last silent symptom that I'm going to talk about today is bladder dysfunction, your favorite dinner topic, right? If you've had dinner already. So bladder dysfunction. I categorize bladder dysfunction into 2 categories, and these are Dr. Mitzi's just general categories. I'm not a urologist, okay? So gotta go. or gotta go and can't go. All right. And sometimes people have a combination of both of those. So gotta go is people who have urinary frequency. So you have to go to the bathroom a lot. It sometimes can interfere with your ability to do activities. I have some people in extreme cases that say, well, I don't go to places if I don't know where to find the bathroom. All right. So urinary frequency is very common with MS. Also, people will often have urgency. Urgency is where you feel like when you have to go, you better get there or you're going to have an accident. Okay, so I have some people that have very little time from when they feel that urge to go to get to that restroom or there's going to be trouble. Okay, so frequency and urgency are part of that gotta go. So there are often medications that we can use to treat that. Again, it's important to talk to your doctor because sometimes there are other things that are playing a part. Sometimes someone may have a urinary tract infection. So that's a very common reason why people have change in their bladder function if they have MS. Also for women, we have things like babies, right? Which can affect things down there, affect that bladder, affect the elasticity of things. And so sometimes people will have some incontinence or difficulty controlling their urine related to previous pregnancies or childbearing. And then for the fellas, the prostate can affect their urinary function. So again, it's important to talk to your doctor. Try to make sure that you're ruling out other things that may be affecting the bladder. And then if there are treatments needed, then you all can talk about specific treatments for urinary frequency and urgency. Okay, so for urinary retention, that's the gotta go and can't go. Your bladder's holding on to too much urine. And so oftentimes that will make people prone to recurrent urinary tract infections, right? So the urine is sitting there in the bladder, which is, urine is not a clean substance. That's why we get rid of it. And so often people will have infections related to that. In that case, there are some medications that can be used to treat that. In many cases, your doctor may have you consult with a urologist, and there are certain testing that they can do to look at the bladder function to see what will be the best way to approach it. There are other ways to treat bladder dysfunction related to MS. For some people, they can receive Botox injections in the bladder, which may help. And then other people may need like bladder stimulators. So again, there's a wide range of treatments. And then of course, there are some people who can have a combination of both of those things, which can be tricky because if we treat the frequency, right, then we may make the retention, the other part, worse. So again, important to consult with your doctor, talk about it. If you have a complicated picture where you have a little bit of both of those problems, your doctor may refer you to a urologist who may be able to suggest kind of the best combination of treatment for the bladder issues that you have. All right, very good. So those are my 3 silent symptoms of MS that I discussed tonight. First, we talked about fatigue, right? That exhausting feeling when you hit that brick wall, that energy is gone and there's just nothing left and you're out of gas. Very common symptom with MS. Important to talk to your doctor because other things that can affect that are insomnia if you're not sleeping, and also sometimes medications can cause increased fatigue. So important to kind of tweak the rest of that regimen, right? And then also cognitive dysfunction, again, is a very common symptom. People have slowed processing, impaired attention and concentration, and easy distractibility. Other conditions that can cause that are fatigue, right? And depression. So again, important to talk to your doctor because oftentimes there's a cycle and there are multiple things that are contributing to a symptom. So we have to try to treat as much, the other issues as much as possible to see what part is left over from the MS. So I usually say there may be this much from the MS, and then we add, let's say, fatigue on top of it. And then if we add depression or anxiety on top of it, then the problem becomes this big and interferes with your daily life, whereas this much of it may be from the MS. So again, important to talk to your doctor to try to sort that out. And then finally, bladder dysfunction, gotta go. That's urinary frequency and urgency, or gotta go and can't go, which is urinary retention. Important to talk to your doctor about things that may be irritating the bladder, like caffeine or alcohol. Sometimes that can irritate the bladder and make you go more. And also to make sure there are not any other conditions that may be contributing to the urinary dysfunction you're having. At times, your doctor may have you consult with a urologist to try to sort out what's going on. So thank you very much for your time and your attention this evening. Again, I'm Dr. Mitzi Joy Williams. I'm a neurologist and multiple sclerosis specialist, and my mission is to engage, educate, and empower people living with MS to become an active part of their healthcare team and to understand the good parts and the merits of clinical research, which is a new passion of mine. So thank you all so much for tuning in. If you find it helpful, please share. The video, please feel free to comment. Again, these are for general information about multiple sclerosis. It is not for specific medical advice, and I can't unfortunately give you specific medical advice. Feel free to drop in the comment section if there are any topics that you guys would like to hear about. I certainly have some in mind, but I will try to address as many as I can, and I hope that everyone has an amazing evening and an amazing weekend. Check me out next Thursday at 7 p.m. Eastern Standard Time, same bat time, same bat channel. All right, have an amazing evening, guys, and thank you so much for tuning in. Bye-bye.